think so, isn't it?
You're right.
It is. I think we're live. Yeah, we are live. Now, I don't know if this gets bigger or not.
I hope it does.
I hope it does. I don't know if we can see the brain
Can't even
thing.
tap on it and make it bigger.
I don't know if I can I? Oh, I can.
Yeah.
Okay, fine.
Well, we are live, I can see.
We are live.
Yep. Can everybody hear us? What? Oh,
Are you watching us?
What?
You're in it.
Just turn the sound down.
Okay. So we'll just wait for a few more people to come on because there's only 2 people on at the moment. Now, I don't know where comments... Oh, comments come down
I can
here.
read the comments.
Oh, you can read the comments. There are no comments at present, so
No,
okay.
nobody said hello yet.
Can everyone hear us, sort of?
Oh, there's like a 5-second delay.
Stevie, it just looks like you're on your phone at work.
There's a 5-second delay as well.
Okay.
I like this. If I say anything weird, I'm going to say it was you. Nobody knows.
And that's how I lose my job. Facebook Live.
I'm not reading my phone. I am just looking at it for any comments, but we haven't got any yet.
Okay. Yeah, okay. Susie has said that she can hear us.
Oh, thank you, Susie.
It's like you're famous and you've just been on the... Anyway. Now, I don't know how long we wait until there are people on here, or should we just dive in?
Well, dive in.
Should we dive in?
Because it can be watched.
Okay. So hi everyone who's watching at home. My name's Sarah. I'm one of the midwives over at Cotswold Birth Centre in Chipping Norton. And this is...
Fiona, hello. I'm the midwife here from Dellington Surgery.
And hi, I'm Stevie. I'm the midwife from the Shipton Under Witchwood Surgery.
Lovely. The dream team. Are we biased?
said.
Yeah, by us.
Yes.
Because we're biased. Today we'll be doing a bit of a Q&A at the end, well throughout to be honest, but we're predominantly talking about a new tool, well a newish tool to me, the BRAINS acronym, or the BRAIN acronym, with regards to making informed decisions. And today we'll be putting it into an example that's quite a common example that people will face of, what are we going to do? We're going to do
We've only been planning this for the last 2
a
hours.
first-time mum deciding to birth at a freestanding midwifery-led unit over being at home or an obstetric unit or somewhere like the Spires, which is at delivery suite, or above delivery suite.
So we have 3 freestanding
Four.
midwifery-led units.
4.
The Horton.
We've got the Horton.
Sorry, Horton.
We've got the Horton here at Chipping Norton, Cotswold Birth Centre. We've got Wallingford and we've got Wantage. Over to you.
Oh.
Or someone else. I can dive in.
I mean, you were flowing.
I'll flow. I'll keep going.
Go on.
I think as a bit of a disclaimer, it's probably important to note that some people may have been advised to birth in some places over others. We're going to stick more to being a low risk, fairly straightforward pregnancy because there's just not enough time today. But if you want to find out more about options that are specific to you, please talk to either your consultant or your midwife or anyone in healthcare. So firstly on the acronym front of BRAIN, is it BRAIN or BRAINS?
It's brains, but we'll come to the S. So
Okay.
start with B.
Let's start with B, which is benefits. So what would be the benefits of being in a freestanding midwifery-led unit over other places? Yeah, go.
Okay, well, we've got the very statistical stuff, which is mostly from the Birthplace Study, which I know I bang on about all the time, but it's like factual statistics and tells you about the different outcomes from labour ward and attached or an alongside midwifery-led unit, such as the Spires, the freestanding MLUs and home. But before we get onto that, we wanted to talk about what we called the fluffy stuff, didn't we?
The nice stuff.
That isn't in this, but the stuff that we could think of as benefits to birthing here, for example. And one of them is you may actually get your midwife, your community midwife, looking after you in labour. you can't get much better than that. I
A
would
familiar
say.
face, certainly.
Yeah, absolutely. It's how it's supposed to be, I should think. You should probably know the person that's looking after you in labour. That's going to make you feel so much more comfortable and relaxed. And it is just the sort of the perfect way to be cared for. If it's your midwife that you've been seeing throughout your pregnancy, it's fantastic if that's the person who greets you at the door. Would you agree?
I would, and it's pretty special for us as well.
Oh, that's
Oh no,
nice.
I always call
It
it
is.
the cherry on the icing on the cake to catch the baby of the mummy that you've looked after throughout
Yeah.
the pregnancy.
Yeah. And then there's other things that being in a midwifery-led unit is less clinical. It's more of a home environment, so it's quite good for those that if you're not used to going into hospital or a hospital sort of situation can be quite frightening, which isn't good for your labour or your birth or your lovely hormones. So being in a midwifery-led unit is a little bit of a step down. It's less clinical. It's more of a home from home type scenario, which a lot of people do find very comforting.
Free parking.
Do the other units have free
I
parking?
don't know, I'm sorry, we do here.
Not at the Horton.
No. I don't think
Oh,
we're supposed to drag the plastic.
Sorry, Horton.
Yeah, but the Horton's got Mackeys, so...
Yeah.
Yeah.
Yeah, but anyway, not in there.
No traffic jams.
No, yeah. Typically they are located closer to your own home, so getting into a car might be a bit of a shorter travelling distance to go to your nearest midwifery-led unit. Over going, light traffic as well.
That's the birthplace study. So this is for first births. I've got the stats here, and you are less likely to have an epidural if you start your labour at a freestanding midwifery-led unit than if you start it anywhere else. So that's at home, an attached MOU or delivery suite. You're less likely to have your labour speeded up. You are less likely to transfer to hospital than if you're anywhere else in the community. You're less likely to have a caesarean. You're less likely to have a forceps or a ventouse delivery. And the most significant statistic, I would say, is that, or the most interesting, is that you are most likely to have a spontaneous vaginal delivery if you start your birth at a freestanding midwifery-led unit than if you start at home or the equivalents of the spires or labour ward.
Yeah. So those are sort of the benefits of being in a freestanding midwifery-led unit, and it sounds great, but we move on to the risks bit. So, now what's the percentage of people that transfer? 36 of first-time mums.
36.3% of first-time mums transfer from freestanding midwifery-led units.
Yeah, so while it has the lowest rate of transfer, it's still 36% of people will be transferred. And if you are a freestanding midwifery-led unit, quite often you're a little bit further away, so you're being transferred a greater distance. Yeah.
So yeah, it's a risk of 36.3% if you come somewhere like here, which you could say is quite high.
But having said that, you're still more likely to have a vaginal birth rather than instrumental or a C-section. And quite often your midwife that's transferred you, who you know, is able to stay with you for that birth.
Mm-hmm.
We're really trying to do that.
Yeah.
So other risks of being in a freestanding midwifery-led unit is that
We struggled.
we struggled. We're biased, but arguably there is limited pain relief in the sense that if you wanted stronger pain relief, there are only certain options available in freestanding midwifery-led units. So again, if you wanted stronger pain relief, you would be transferred in that instance, and some people do find that kind of a risk, especially if you've not laboured before and you're not really sure what you would like during your labour, if you do want further pain relief and things like that. And then the last risk that I kind of thought of was typically there are less staff manning a midwifery-led unit at one given time. So, I mean, it's all relative, but because we have fewer births, but arguably you're a little bit more likely to get a midwife come from further afield if your named midwife is already out in an evening, that sort of thing. Can you guys think of any other risks?
It's quite rare that happens though.
It is rare, but I couldn't think of any other
We're
risks.
quite protective over being here for our own mums. So,
Yeah.
I don't know, it's the word risks, isn't it? Because if we used
I think you
negatives
should use the
rather than
word
risks.
chance rather than risk. The chances are.
But that
It'd
doesn't
be
fit
really-
in. That'd be
It'd be hard to
BK.
pronounce, wouldn't it?
Yeah, I know. Sorry.
Same as negatives, but I mean there are negatives. I would say the sorry.
You're now laughing at the word BK, aren't you? Oh, we're going to change it to cabin.
I would say that there's negatives to birthing at a midwifery-led unit rather than risks. So we've really, tried our best to find some risks. We've managed a couple, but there's more negatives. Anyway, should we talk about alternatives?
I think we should. Are you going to rename that one to make it a completely bizarre word? Alternatives. So, again, this may vary on person to person as to where they may recommend that you birth, but again, considering the low risk, straightforward pregnancy. The alternatives is that you could consider being at home, have a home birth, being in an obstetric unit, so delivery suite, specifically at the John Radcliffe, or an attached midwifery-led unit, so that's the Spires, which is level 7.
Can we take a question? Because there is a risk
Oh.
question.
Oh, there is a question. Yes, go.
So, Nikki Ford says, what's your recommendation regarding birth location for babies estimated at greater than the 95th centile from the 36-week scan? I was planning on going to Wallingford, as I went there with my first. It was also a large £9.10, or £9, yeah, £9.10, but I had a call from a consultant last week suggesting I might be safer going to the Spires due to the risk of shoulder dystocia. Thanks.
That's a good question.
Great question. Thanks very
May
much.
I?
Go
Go
for
for
it.
it, Fiona.
I advise that you have a glucose tolerance test if you haven't already. You've probably been told that, I assume. Other than that, it doesn't make you out of criteria to birth in a midwifery-led unit, does it?
No, it doesn't. And if you had a normal vaginal birth with your baby last time as a primate, when it weighed £9 10 ounces, chances are.
Yeah. However, if it's worried you, this is what sort of the intuition is about, which I don't want to miss out. We will come on to it, but it has got to be, you've got to birth where it feels right for you. And if it's started to worry you and things like that and you feel safer, then that's absolutely your decision. So I'm not going to advise your place of birth. I think you need to think about what feels right for you, and if having that extra information has changed what you wanted to begin with. Like, did you really want to birth in the midwifery-led unit at the start, and how much has it changed from that extra information? There is no right or wrong, and none of us can look into the future, sort of thing.
Sorry, shoulder dystocia is an obstetric emergency. We are all trained to deal with it, and that's what we do if it happens. We can't really, alright, they're saying they can predict that it might happen with the larger babies, it's not necessarily with a larger baby, especially if you've already had a baby already.
Yeah.
That wasn't one of our risks, as that's not a risk of birthing in a midwifery-led unit. That's a risk everywhere. It just is something that can happen, unfortunately. It's a low risk of it, but it's not a risk of being at a midwifery-led unit, if that makes sense.
You said her test was all clear.
Yeah, for the GTT test, presumably. Yeah.
I'll explore that a second. So, in the absence of diabetes, which is what the GTT, the glucose tolerance test, is screening for, most people make a baby and grow a baby that fits their body, so that the birth should go smoothly, and does in most amount of cases.
Yeah. But should we move on to the eye, because I think that's helpful.
Then we are writing Brian's instead of brains.
No, we did the A of the alternatives. Where else you could
we?
go?
No, we haven't.
Oh, sorry, yeah,
Did
we
I
did.
not? I did.
It was very
I
strange.
did. They weren't listening, but I did say it. Anyway, would you like to redo the alternatives?
Well, I don't know where I was, but
Where else could you go?
we talked about that. She did say it, I remember now. It's just very quick, isn't it?
Just not memorable, guys.
Yeah. So intuition.
Yes. So this is kind of going on from the question that you asked. So, yeah, in view of perhaps having a slightly bigger baby than last time on board, if you are going to feel nervous or on edge being in a freestanding unit, then you may want to think about being closer to the delivery suite or on the spires, as I think you've probably been advised. But equally, if you feel safer being in a midwifery-led unit, a freestanding one, then we would support you. You have to be wherever you feel safe, and that's the same for everyone in every instance. Some people that have absolutely no complications at all still feel safer being in a hospital environment, and that's completely fine. It's subjective.
Yeah. Also, you know, if you're under midwifery-led care and deemed as low risk, you can decide when you go into labour. You know, it doesn't have to be set in stone. You don't have to tell someone where you're definitely going to give birth. There's plenty of people that book to have a home birth, but then last minute want to come here, or vice versa. Some people think they're going to come here, but then actually they're feeling good at home, and that's where the hormones are working for them best, and they don't want to move. Great, we'll come to you. So nothing has to be set in stone, and actually when people are in labour and behaving like a mammal who's giving birth, basically, they will feel what's right for them then and there. So maybe someone wanted to have it at home, but actually delivery suite is calling them, and that's absolutely fine as well. We don't say, no, you're not coming here. You said you were going to have your baby at the Spires, for example.
No takesy backsies.
Exactly. You can change your mind.
Yeah.
And we want to support you. We want you to give birth where you feel is right for you. Yeah.
And yeah, that's all about instinct and intuition on the day, isn't it?
Yeah.
Cool.
Absolutely.
And then, so the N of brains is usually nothing.
It is, but that would be boring, wouldn't it? What would we say about that?
We'll talk about anything.
Yeah.
It's not really applicable if you're in labour.
No, it's not.
Well,
Although you
it
could do
sometimes
nothing.
is actually.
Yeah,
In
it could
different
be at
situations, nothing. You can ask what would happen if you did nothing for a bit, and
Yeah.
that's a perfectly good
Yeah.
question. But in this, it just wouldn't spark much conversation, so we've done next steps instead. So you guys this may have triggered some more questions, or might have helped you change your mind or pick your birthplace, but what can you do now to further sort of get the knowledge to make your choice? So carry on watching things like this, get as much knowledge as you possibly can.
Because we're so wise.
Yeah, so wise. If you're the sort of person that likes statistics and research, the Birthplace Study, here I am talking about it again, but it has all these numbers there.
We'll put the link on after this.
Yeah. Sorry.
I was just going to say it's data of 64,000 births.
Yeah.
We
So
were
it's
all
a
involved in it
yeah.
a few years ago.
It's evidence-based, unbiased, and it's just really good. If you like reading statistics, if you like having that, find it quite comforting and making decisions, and it's a really good one to have a look at. It's quite old now.
Yeah. 2011.
2011.
Also, the benefits we were talking about of birthing at a freestanding MLU, remember we were quoting them about first births, and actually it's quite a lot different for second or subsequent births, with home being one of the best options for many of those outcomes. So that is worth mentioning.
Yeah.
We're talking about first-time mothers, and the stats do change for second or subsequent births. Okay, so it really might be worth exploring if you're not a first-time mum, if you like the numbers.
Yeah.
What are the next steps can people do to prepare? Talk to your community midwife. Am I coming out?
No, you're in.
Ask your midwife questions. ask us questions now if you want to. I don't know if anyone
Oh, hang on.
has.
Oh, I'm scrolling.
Oh,
Oh, Charlotte.
Selena Cotswold is asking, is this a general Q&A session or on a specific subject? So we've related it to birthing, first time moms birthing in a standalone midwifery unit.
I mean, but if we've got time, we can ask general Q&As anyway, can't we?
Yeah.
Yeah.
I can see loads of things there. Obviously, I can't read them, but what else is being said? Yes, ask us a question, Selena.
Celine, yeah.
Sorry.
Oh, you've got a fan, Fiona.
Okay.
That's rare, isn't it? Just kidding. Just kidding. You all love Fiona.
Any questions there?
Not so far. We'll give them some time. Give them some time to ask some questions.
Pictures of a job. Choose to talk about another scenario.
Could talk about what we could talk about brain in relation to something else.
Yeah.
Yeah. What would be useful? What's a good?
No.
Should we, if we make it midwifery-led unit specific, also?
Olga is asking, do women tend to stay longer in an MLU than in the delivery suite with John Radcliffe?
Oh, okay, questions.
That's the question.
Okay, so do they stay longer in an MLU than a delivery suite in the JR? Is this postnatally, I assume?
Yeah, I presume so.
It's a little difficult because a proportion of mums that have had their babies on delivery suite may have had other complications. So typically, postnatally, delivery suite will probably have a longer inpatient time, but that is a little biased because there's usually there's quite often other factors as to why they may be staying longer. But if you have a very straightforward birth, whether you are on delivery suite or here, it's about the same time. Depending on what pain relief you may or may not have had, but if all's all quite straightforward, then it's typically about the same time to discharge. If you're going straight home from delivery suite, no complications.
We'll get some general questions now. Judith is asking, I've been advised to go to delivery suite so the heartbeat can be continually monitored. Does this mean I won't be able to have a water birth?
It kind of depends, Judith.
Yes.
It does depend. Sorry, I'm talking way too much. Would you like
No,
this?
you're not
I'll take it. I'll take it. There's a number of reasons as to why a baby's heart would be continuously monitored rather than intermittently auscultated. So this is done on delivery suite, but they do have a pool on there. Now it kind of depends as to why it's been recommended that your baby's continuously monitored, but there is a pool and you can be continuously monitored in a pool. But it kind of depends as to why you're being continuously monitored, as to whether a pool would be recommended or not. I hope that's helpful. It's a little bit vague.
So it's not a definite no.
Yeah.
Because we don't know the sort of ins and outs of your pregnancy and your care and stuff. I would definitely talk to your midwife about it. She'll know a bit more about you and be able to advise appropriately.
Yeah.
Okay.
But being on delivery suite for continuous monitoring is not enough to forgo the pool.
I'm loving this next question. Charlotte says, if me and my partner have another baby sometime next year and my daughter had him on twos, would that stop me having another baby at a midwife-led centre? Sorry to ask this. Also, what would be the rules next year? Oh, so we've got two lots of questions.
Oh no, so
von twos?
Yeah, go for it.
No, that wouldn't rule you out at all. Von twos or forceps happens quite often with first babies. Everything's stretching for the first time. Sometimes labours are drawn out. So yes, it can be a lot quicker the next time, and generally a spontaneous vaginal birth with no assisted delivery at all.
We would love to have you.
Yes, come back. But yeah, and equally, even any instrumental delivery is welcome to come back to any freestanding unit.
It's generally the case.
Yeah.
It's just with first babies.
Fine.
And what are the rules? I'm not too sure.
Rules, I assume with regards
Is this with COVID?
to COVID?
I don't really know. So we can't really answer that question. You mean rules? Just remember, nothing is the law. You can actually, like, this is what the brains is for, to actually challenge what you're being told to do, because nobody should tell you what to do. It should be advice, and everything that you choose to do should be with informed choice.
You said it, sister.
Yeah, I did.
Nikki is asking, what types of induction can you have at 41 weeks? Well, in the community, you can be offered a stretch and sweep.
Yeah.
In terms of it.
For midwifery-led women, we can offer that you're booked in for an induction from 41 plus 3. And there's different ways of doing that now, and I think the mechanical way of inducing people is what's being used now most of the time, isn't it? And it seems to be having pretty good outcomes in terms of delivery.
Yeah.
What did the actual question say again?
What types of induction can you have at 41 weeks? So I guess if we talk about the balloon induction, I guess.
Yeah, I mean, you crack on. Not an expert.
So again, this is in fairly straightforward pregnancies with no other complications. So some people are offered induction slightly earlier. So assuming that everything is very straightforward, an induction will be offered from 41 plus 3. And typically people are offered something called a balloon induction, whereby a small inflatable, it's a catheter lead that has a balloon on the end, is inserted into the cervix, and it's inflated just gently. You then have a monitoring of your baby for a little while, and then you're sent home, where somebody will go into spontaneous labour on their own, in which case, again, providing everything's straightforward, then you can still go to a midwifery-led unit, have a home birth, or go to the attached midwifery-led unit that Spires. If after 24 hours, however, nothing's happened, you've not gone into spontaneous labour, or the catheter itself hasn't fallen out, then you are invited back in, and that's when the induction process sort of furthers on delivery suite, which I guess is, yeah, fine.
Well, the point of it, isn't it, is to open the cervix enough to be able to do the next stage,
Yeah.
which would then be to break the waters.
Break the waters.
Manually.
Yep. Give you some time to mobilise to see if that sparks off spontaneous labour. And then sort of as a last port of call, you would be offered an oxytocin, so a hormonal drip, which would be on delivery suite if you were offered that one.
And that's if these previous interventions haven't already sort of triggered labour and got your body to take over itself.
Fine.
Stretch and sweep, which us guys do, we can do in community. It is really a form of induction in terms of it's an intervention.
Mm-hmm.
It is trying to change things inside to try and get labour to start, and it's not a natural thing for us to do that. So it is in a way a method of induction, and depending on your pregnancy and everything is when we can offer it. So it's what you speak to your midwife about when it's coming to the end of your pregnancy.
Yeah.
If you want to. No one has to have it.
There's another question. Kylie says, I'm currently 41 plus 6 and looking as if I might go over 42 weeks. I have declined 2 inductions so far, but I'm confident I've used brain to advocate for myself and my baby. Well done. Can I still use Wallingford?
Oh. Now then.
I'm not going to say yes or no. I think you should ring Wallingford. I assume you're in contact with someone anyway, with your midwife, and you've got support and things like that.
Yeah.
It would certainly be nice for you to speak to somebody soon. And if that's where you would like to birth, I would speak to somebody there, but perhaps explore all your options.
Yeah.
Somebody who can speak to you about all of them, and so you can decide the benefits and risks of being in all places,
Yeah.
so you can get a proper, well-rounded sort of view of all those places to birth at.
Yeah.
And good luck.
And I think having a chat with your community midwife who knows a bit more about you, hopefully you've had a bit of continuity with them, then you can have a chat and potentially have a further discussion with one of the consultant midwives if you wanted to have that, to put a bit of a plan in place. But yeah, good luck. Ooh.
I've got another question from Helen.
Okay.
I'm currently in the position of having had a quick first labour, born about an hour after arriving at the birth centre. No pain relief, water birth with no complications. Was advised to home birth and have since had positive group B strep. I have an appointment booked with a consultant midwife to discuss the risks.
Mm-hmm.
But is there any thoughts you can give as to what to do, please? Feel like I may not have a choice where I birth if baby comes quickly, but just trying to be best prepared. Would absolutely love another birthing centre birth though, it was perfect. Unfortunately, doesn't look like an option this time though.
Oh.
Oh,
Well,
So the advice may be to have IV antibiotics through your labour, Helen. Though if you had a quick first labour, perhaps you would only get one dose in any case, but you would be supported in whichever decision that you chose to make. You're a good person for this one.
yeah.
all right.
Yeah.
You do have a choice, unless what you're worried about is that you want to be where it is advised, which would be somewhere with access to IV antibiotics, yes. So obviously there's a risk of the group B strep transferring to your baby. Now it's a low risk, yes, but the outcome can be bad if that does happen, and we're not going to deny that. So now that has been thrown into your labour, whereas before you were probably just thinking, great, I'll have a home birth, I know my body works really well, I've done it before, it'll be nice and quick. Now you've got this other thing going on, and it makes it really difficult, because now you've got risks and benefits for both staying at home and going to the hospital. By the way, the Spires, which is the midwifery-led unit at the JR, can give intravenous antibiotics, so that's another thing to explore, yes. But I think what you're asking is it a real big worry if it does just come really quickly and you can't get to a place where there is access to antibiotics? I get from your question that that's your sort of worry. Now, if you did have a baby at home and we knew that you had group B strep, then you'd still want a midwife and everything to come and look after you, but perhaps keep a good eye on the baby afterwards.
Mm-hmm.
Observations, checking the temperature and things like that, signs for infection. Now, some people have group B strep and just don't know. It's quite a tricky one. It's not that all babies at all will contract GBS from their mothers when they've got it. There's not a huge high risk of that. It's just that antibiotics will lower it further. So I don't know how much I'm helping here, but I certainly would speak to the consultant midwife, explore all these options further, but try not to be really worried about the fact that you may end up having your baby at home, and that wouldn't necessarily be your first option at the moment, okay? Because all midwives who will look after you and do your care will want to keep you and your baby safe as well, okay?
Yeah, and please don't feel like you don't have any decision to make, and the decision's been forced for you.
Yeah.
It really hasn't.
Yeah.
But it sounds like you've got a good appointment to go to ask these questions and get.
Yeah, and make a plan in all circumstances.
Yeah. Now, Stevie, I think you missed out one accidentally.
Oh, have I? Sorry, Helen's actually replied to it as well.
Oh no, that's just a nice message.
Oh, yes, well, I liked it. It is a nice message, just somebody saying
No.
thank you.
Yeah, the one I thought you missed.
No.
Okay, no, we haven't missed. It's just a nice comment and we skipped
So
it.
Helen has just said that she's sort of come around to the idea of starting to prepare, then got the group B strep curveball and was told to go to hospital for birth. A week before they said they thought I wouldn't make it if I tried. So a bit stuck on what to do really, and feel like I'm going with the advice against at the same time. All I'd say is if you feel like your baby's coming, do not get in your car and drive to the John Radcliffe. you call your community midwives. You also dial 999, then we know we've got an ambulance on the way, just because it's an unplanned home birth. And catch a baby at home.
Catch a
And
baby.
then we deal with everything else afterwards.
Yep.
But you don't get in the car, because you won't get the antibiotics in labour anyway, because you'll have had a baby on the way, which won't be very nice. So stay at home. Is that all right saying that? Why are you asking me?
You've got permission.
You agree?
I think if you do feel like you have time and you're planning
Yes.
to have IV antibiotics, then make the effort to get them. But yeah, things go beyond your control. Please don't worry about that. Now, someone's asked, will my partner, oh, it's Charlotte, will partners and my daughter be allowed in throughout the pregnancy, appointment scans and labour? It's impossible to say. We don't know what the rules will be going forward. Hopefully, we've got partners now attending more appointments than they were before. But with regards to your daughter, I can't remember what the rules were with children under 16 in any case. Anyway, at the moment, we're just not sure.
Partners say yes.
Partners say yes.
Appointments.
Yeah.
Which is really nice.
Gemma is saying she's scared because she's pregnant with her third. My first was 2 hours, presuming in labour, and my second was 19 minutes.
19 minutes.
In September.
That's impressive.
Yeah.
Okay. But don't be scared.
What are you scared of?
Yeah.
Scared.
What are you scared of?
Yeah.
More specifically.
Oh, quickly, can you tell me? What are you scared of?
Oh, she's used that like monkey laugh face.
She has.
I do like that one. I do use it often.
I'm in no means making fun of you, saying what you're scared of. By the way, I just want to explore it better with you. So it would be,
Yes.
are you scared of having a baby at home? Are you scared of having it quickly? What is it that's bothering you?
Yeah.
Because it sounds pretty,
We'll have to wait for an answer.
yeah.
Yeah.
But hopefully you've got a very understanding community midwife, and I would make sure you talk to her about that.
There's a bit of pepper on the floor over here.
Is that? It just seems a bit lovely. Fine. Now, does anyone have any other questions? Either place of birth specific or others. Can you see any more questions on your phone? It does look like Stevie's just got bored and she's just
Helen's
scrolling.
thanking us. You're
Oh.
helping us, thank you. I'm also following advice from the professionals. It just seems like a real flip.
Yeah, and it's
It's given me more confidence that doing the prep for the home birth is a good idea, and try to get to the JR if we feel we have time. Great.
sure.
Yeah.
Great. Fine.
Lucy's got a question.
Oh, question.
Hang on a minute. Random question. I'm expecting my first baby end of July. What is the process of coming into hospital? When do I know that I should come in? Is it after my waters break, or to the point that my contractions get stronger? I will be giving birth at a hospital about half an hour from where we live. So I wondered whether it would be a good, right time to make my way over.
Okay.
All sorts of things there.
So there's lots. Okay, fine. So,
I know we sort of stepped
When
away,
do I
but
know
you
that
still
I
use
should-
your brains.
yeah. Oh. I'm just going to say the general thing. I'm not going to
Yes.
make it brain
No, no.
specific,
No,
otherwise it
don't.
will go on for ages. So depending on where you're going to have your baby. What have you said? At a hospital. Okay. So, I mean, there's so many different questions in here. Typically, for first time labour and birth, you'll be invited to come into the hospital when you're contracting, sort of 3 to 4 contractions in a 10-minute period, regularly, and they're lasting greater than 60 seconds. However, it varies from person to person, and we will have a chat with you directly over the phone on how you think you are doing and whether you would like to be in sooner or if you're quite happy at home. Statistically, the longer that you stay in an environment that you feel safe and secure, i.e. your own home, the better it is for your outcomes of your labour. Because getting into a car prematurely can cause a rise in adrenaline and cortisol and stress out your hormones, which can knock off your contractions altogether. However, you did also say about your waters break. Is it after my waters break? So it's not always after your waters break. Sometimes your waters don't break until your baby is born. So don't go on waters breaking specifically. However, if your waters do break during your contractions, then we do like to have a chat with you about baby's movements. We like to know what colour your waters are after they've gone, if possible. Sometimes we'll ask you to wear a pad so that we can see that and ask you questions about that. And it's very common for your waters to break before labour starts at all. So some people just, their waters will break and no contractions will follow. And we do like to know at that sort of point as well. I will be giving birth at a hospital half an hour away from where we live. It's kind, yeah, it's plenty of time. Plenty of time.
So,
And
Gemma,
then, Gemma said why she's
Gemma
been
is
scared.
like, Gemma with the 19-minute labour, I'm scared about it coming really quickly. As my son who went to special care, he was a quick one, and he had
I'm guessing
I think
pneumonia.
that's pneumonia and sepsis and couldn't breathe through his nose. And babies are nose breathers, so that would have been difficult. Right, okay. That's very rare.
Yeah, and I'm sorry about that. That sounds
Yeah.
very unpleasant for you. Where were you?
We could just get asked loads of questions about
Sorry,
this now.
I'm trying to understand for it to be 19 minutes. Was it an induction which you reacted very, very quickly to? Were you already in hospital? I'm just trying to work out your the likelihood of you having an unplanned home birth, basically, or if it was slightly different circumstances where you were sort of helped to go into labour anyway, which, I mean, obviously that's in a controlled environment, and I'm not suggesting that that is what happens this time, but I don't know if it's something that could be explored. So it's very hard to tell you whether that is likely to happen again or not without knowing your history. And I know I keep saying it's like I'm fobbing people off, but when your midwife, who probably knows you quite well, that's a great person to discuss this with and to make more of a bit of a plan, and so that you feel a bit better going into labour, because I completely get that is scary.
Yeah.
And it would be nice for you to feel well supported and less nervous about the whole thing. Okay. It's not helpful at all from me, is it?
Well,
No.
it's difficult.
Fine. Rachel's asked an interesting question. What's the transfer rate from alongside midwife-led unit to delivery suite?
Oh no,
It's more.
it's slightly, it's like a point of it's a percentage higher, isn't it?
24% as opposed to our 18%.
Is that that's
Sorry,
for
what's the
all
question?
mums? So for first time mums and those that have had babies before,
I'm sorry.
because it's a combined rate, isn't it? So Rachel's question is, what's the transfer rate from an alongside MLU to delivery suite?
Okay. Have you got the figures for when the numbers combine?
The numbers combined.
Is that what or was it for a second time
The
month?
question was, what's the transfer rate from an alongside
I'm just
MLU to delivery suite rather than a...
We did our original percentage
It's
based on
8.
first time mums, but I just do the overall one.
Well, there isn't one.
Oh, fine.
Well, not on here, anyway.
Okay, fine.
So for first time mums, transfer rate from an alongside, is that what you said?
Yeah, transfer rate from an alongside
So,
to delivery suite.
An attached midwifery-led unit for first-time mothers is 40.2%.
Yeah.
Now, bear in mind, it's a lot easier to transfer people down, which is probably why it happens more often.
Yeah.
Sometimes it might be unnecessary, but...
When you think about factors and stuff, when somebody may ask for an epidural, it's very easy to respond to that very quickly because it's not far away. Whereas here, although it doesn't happen very often at all, you've really got to consider whether you're actually going to have a baby before that would happen anyway, or if somebody's just got to that point in labour where they're going to have a baby soon and that's why they're saying it. So you've got to bear in mind things like that. It doesn't mean that there's more, it's not necessarily to do with the outcome that the transfer rate is higher. God, I go off on one, don't I? Second and subsequent births transferred to hospital from an attached MLU is 12.5%. so pretty low. And I haven't got the brain power to combine those to make a different percentage, I'm afraid. But it's pretty low for subsequent births. As it is from freestanding NLUs, by the way, it's 9.4%.
Home birth?
Home is 12%.
Fine.
Okay.
Gemma is now following up on your question.
Okay, sorry, Gemma.
So Gemma had her baby at the JR. Her waters went in and he arrived, but she was 36 weeks pregnant when she was found out she was pregnant. Okay, fine. So she's worried she won't make it in time. And this one needs help. This baby one.
Talk to your community midwife.
Yeah.
You need some reassurance.
Yeah, I think a plan needs to be put in place so you're not worried your whole pregnancy. I do want you to be reassured that most babies do pretty well, and obviously you know that you're pregnant a lot earlier this time, which most people do, and you know that changes pregnancies. If you didn't know you were pregnant before, you probably weren't getting routine care. I don't know why you went into where your waters broke or what point or anything like that, so I haven't got the bigger picture. But make a plan with your community midwife, okay? So you don't worry about it your whole pregnancy.
Yeah.
Thank you, Gemma.
Now, Alexandra has asked, apart from gas and air, can you have any other pain relief during a water birth?
Well, it's pain relief in itself. The pool is, the water is, you know, under, it's a non-medical pain relief, but it certainly is one. And the research has shown that it's actually a very good one. With people are unlikely to then go on and have epidurals where they've got low rates of it if you've been in the water for part of your labour. So at MLU you actually have a really good pain relief, which is the water itself.
Yeah.
When you're in the water, yes, you can have gas and air with it. It doesn't happen very often here. Certainly when I've been looking after people, I can't remember many times at all, if any, that someone has wanted to have an epidural, because most people are in that pool with gas and air and they don't want anything to change, they don't want to get out, and that's how much of a good sort of combination it is. Here, I can't actually remember the question. See what happens to
It's other pain relief. So
in the water.
in the water, there's also water for injection, but that's recommended for those that have back pain specifically. In terms of a pharmacological pain relief, we offer an opioid injection here at Cotswold Birth Centre, but if you do accept it or would like it, it is recommended that you are not in the pool, as it can make you very drowsy. And then stronger methods, again, epidural is only available on delivery suite at the JR. Hope that's helpful. But we also have aromatherapy, massage.
Yeah. TENS machines and everything.
TENS machines,
but not in the
not
water.
in the pool.
Electricity and water.
Not
bad.
good. Yeah, that's helpful.
Nicole's got a question now. Do you want to read that? You can see the question.
Sure, I have recently had a private scan where they have told me that my baby is large. I was planning a water birth at MLU. I am 32 weeks and he is measuring £5.9 already. Does size of a baby affect where you give birth?
Oh. For a start, it probably isn't very accurate, the actual estimated weight. They're not very-
It's a really difficult one, Nicole,
Really
because
difficult one.
there are a number of different reasons why. I mean, people have different sized babies. We know that, and that's just how that is. As Fiona said earlier, if there are no other factors, then it's rare that someone will grow a baby that is too big for their own specific body. However, there are medical conditions like diabetes, for example, that can cause you to grow a bigger baby. So hopefully, hopefully you'll be offered a GTT, so glucose tolerance test, to rule out any other conditions going on. Do you want to weigh in?
No, I didn't.
There was a private scan as well.
So, oh no, we've had loads of questions, now it's gone.
Oh.
Which one was that?
So Nicole is 32 weeks pregnant. and she had a private scan where they said that her baby was large, and she was planning a water birth at NMLU. Does the size of her baby affect where she can give birth?
I'm assuming you've got a follow-up scan, or one that's been offered in our trust at 36 weeks. It's very difficult for me to judge a 32-week scan. I mean, I'm not a sonographer anyway, so I'm not going to pretend I'm an expert, but we're quite used to seeing 36-week scans and following a pathway with a baby whose abdominal circumference is in the higher sort of range. It's really hard for me to advise you off that scan when it's done privately. But certainly you can explore it with your midwife after your 36-week scan. That's what I'd say to do. And if certain measurements are higher, you may be advised to have a glucose tolerance test. At 32 weeks, I'm not even sure what £5, I don't even know how big that is in comparison to other babies, to be honest with you. So, but it shouldn't necessarily affect where you give birth. It may affect how you feel where you want to give birth, and actually that's the most important thing, rather than us advising you either way. Okay.
Hopefully you've got some follow-ups there, Nicole.
So Emma's asking, I'm 38 plus 1 weeks pregnant. I'm hoping to birth at the Horden MLU. I think I heard you mention earlier, if I haven't gone into labour before 41 plus 3, I'd be offered an induction. But I could then go home and hope for the labour to continue naturally. Yes, we did hear that.
Yes, yeah, that's true.
Also, it's you're offered it from then. You don't have to have it at 41 plus 3. We sort of write in a range of what you'd like from the earliest to latest that you would be happy to be induced at, if that makes sense. So it doesn't have to be at 41 plus 3. We can just offer it from then. Okay, so that's not like it'll be an end all when it comes to induction dates. All right.
Yeah.
Yeah, and the thought is, because it's done sort of with this balloon thing, it doesn't involve hormones. It shouldn't therefore make you go into labour very, very quickly or react sort of inappropriately, because
it's a similar sort of principle to a stretch and sweep. So there aren't any hormones involved, and it's sort of just stretching your cervix and
So our thoughts are it's reasonably subtle, which I suppose is another reason why it's offered a bit earlier, because it can take a little longer, because it's supposed to be slower and gentle, and therefore let your body take over if it's time for it to do that, rather than give hormones that may make your body react quite quickly. And that's why people can go home, and it's thought that that's a pretty safe option, a good one even, where your oxytocin levels may be higher and stuff like that. So, then you could go home if your pregnancy remains normal and that's deemed as a safe option. Then yeah. So the answer to your question is yes. I could have just said that. Sorry.
So Charlotte has said that for her first baby, her waters went in, her baby had done a poo, and then they had to get her out quick. Could that happen again with my next baby? Yes, it could happen, but it's a different, if you're pregnant again, it's a different baby altogether. So it doesn't necessarily mean that you are predisposed to having another baby that does that, or anything like that. Wouldn't mean that you would be recommended to be on delivery suite or for any other reason. So it would be taken as an entirely different pregnancy or labour or birth. But it could happen again. Nothing to say it absolutely couldn't, but no, there's nothing to say that it would just because you've had a baby before that's done that. Ooh. Ooh.
Thank you for the reminder, please. I'm still going to be able to go to the NLU, even if I need to be induced.
Yes. Yeah. Great. We've got 6 more minutes before we're kicked off. Has anyone got any other questions?
Speak now.
Oh, you're welcome. Quite a good idea, the live Facebook things, I think.
Thank you very much for listening.
Yes.
Yeah, thank you.
Shall we leave it there?
Yeah, I think so. So,
Yeah.
no more questions.
Oh, no, there is one more question. How long can you stay in a birthing pool at any given time? In brackets, with no complications. Wasn't sure if it was in. Oh God, no! Everything's moving up. If it was encouraged for hours or / the majority of labour, or if a combination of pool and other methods would be recommended.
I mean, there's not a straightforward answer to that, so shall I get this one?
It depends how long everything's lasting. You might get a little bit hot and fed up in the pool. We do get you out for a wee sometimes, walk up and down the corridor, you can get back in.
Yeah. Go on, Sarah.
Oh, I was just gonna say there's no sort of max time necessarily. However, sometimes a change of position and getting out of the pool where you're less buoyant can help you in your labour and your birth process. So there's no max time where we kick you out as such, drain the pool because we're mean. But there may be occasions where we sort of suggest having a bit of a plod about on dry land for a little while. But nothing specific recommended. Here at Chipping Norton, the majority of our labourers are in water and the majority of our births are in water. But there is a slight difference in those statistics. So most of our women will labour at some point in water, but some of them will get out to deliver. But it's individual. It's whatever you feel most comfortable with. Hopefully that's helpful. Would you like to weigh in?
No, I'm good.
No?
There is another question
Oh.
from Rosie.
Okay.
I'm a first-time mum and also worried about what if I have a very quick labour and I don't make it in on time. I have had the mobility and I've read that people with this tend to have quick labours. If I end up with an unplanned home birth, I'm also 30 odd minutes away from the closest centre, is it safe to get in the bath and try to do a home water birth, or is that advised against for any reason?
Although I can't rule out a unplanned home birth for anybody, it doesn't happen very often. And actually, especially for the first time mum whose body's never done it before, your body has to do a lot of work in labour to birth a baby. So not a lot of people go from not knowing they're in labour to having a baby. Lots of stuff inside has got to happen, which is why, you know, for 9 months you walk around carrying a baby and growing it, and it's safe. And they don't just fall out in supermarkets and stuff. You've kept them very safe and secure inside. Therefore, it has to be hard to get them out. You know, this is why it's called labour. Your body has to go for a lot. So I think it's very unlikely. I don't know the stats of hypermobility.
No, I didn't know that. I'm going to look into it. But equally, I think because you asked about having the baby in a bath, we have delivered babies in baths at home. We are quite mindful of temperature of water, if that were to happen.
And how deep you can get.
And how deep you can be,
you
yeah.
must birth the whole of the baby under the water.
Mm-hmm. If you're worried about having it at home, then I probably wouldn't get in the bath where you find it comforting. I would probably get to the place where you want to have your baby, if that makes sense.
Yeah.
However, if, you know, a quick delivery is something that your midwife says that you may be likely to have, and you feel like it would be better to plan having at home, maybe having a home birth discussion would be a good idea, and actually maybe getting a pool if the idea of water does appeal to you. There's lots more room in there than a bath. All right.
Yeah, I think that's it.
Okay, so that's the questions.
Yeah, it is. So thanks, guys. We've just done it in under an hour, which I think is impressive.
Yep. That's it.
So we're gonna say goodbye, and I think we're doing this now. How often? First, something every
Yeah.
something.
I think we're doing it again. We're doing it once a month, if that's okay.
Yeah, it's okay.
Just messages if you've got any ideas for subjects.
Yeah,
Yeah. Oh yeah, that's a good idea.
that is, yeah.
We've done 2 of these already. One was on home birth and the other one was on pool birth.
Yeah,
Yeah.
the pool birth one's quite funny. If you guys want to go and have a look at it.
Yeah.
No,
I mean, it's very informative, but it's also quite funny if you guys
Informative.
want to go
funny.
and scroll down and have a look at it.
Anyway, goodbye.
Bye.
Oh my God.